Hi, Dr. Nick. It's a pleasure to have you with us today. As to my understanding, you've been using GSH complex in your practice for a few months now. How did you come about to get to know the product and glutathione?
Mm-hmm. Thanks for having me here, Jeremy. A great product to implement into our programs here in our naturopathic clinic for one of the main reasons because accessibility. So glutathione, typically in our practice, we've been administering it through intravenous vitamin protocols, and it becomes a cost-benefit ratio mostly for patients. So to be able to have access to glutathione and its precursors in a really easy to use and simple program, it's a great compliance piece for patients to be able to adhere to. So whereas glutathione week or so, glutathione or GSH complex is something that my patients can be taking every day. So it's definitely a value add for individuals being able to support those glutathione levels on a regular basis.
So tell me, what is your implication using GSH complex?
So glutathione is definitely a treatment of choice that we use in our clinic for many different ailments, whether it be cancer prevention or detoxification or general sense of well-being and optimal wellness. And often what we would do would be administering IV vitamin drips and including glutathione as part of the detox package and health support package intravenously. So the problem is that, as some of us may know, that glutathione isn't readily absorbed when taken in its purest form, so we need the precursors. And because IV therapy can get quite expensive to keep the elevated levels of glutathione, I was very happy to see that there's a product such as GSH that allows for a daily dosage of the precursors for building glutathione levels. And cysteine as one of these main precursors along with selenium. So in my practice, I've been able to use GSH for a couple months now. And the great thing is that it's something that people really understand, and they really start to get that chronic illness and optimal health and wellness coincides with remaining or keeping antioxidant levels high. And part of our consultation and education process is teaching about some of the roles of these really major important nutrients such as glutathione. So getting a daily dosage of the precursors that help to build and repair glutathione levels is something that I know I can keep my patients in a protective and a preventative state to be proactive with their health and to also treat chronic illness when it comes up. So a couple of patients that I've had an experience with using the GSH, one that comes to mind has had irritable bowel syndrome and supplementation of GSH complex. It's been something that's been really corrective for her, and to the point where she just comes back on her own and picks up her GSH complex because she's enjoying it so much. Another patient with who's been type 1 diabetic for a good portion of her life, we've been implementing this protocol on as well, and as some of us on the call may or may not know, diabetes basically or essentially the type 1 levels is the dysfunctioning of cells within the pancreas that don't allow for proper blood sugar regulation. And so what happens is there's a whole lot of toxicity that builds up in these patients and chronic illness sets in. And there's a significant correlation with actually all chronic illness and a degeneration and a dysfunctional level of glutathione. So in these chronic illness patients, GSH complex is a fantastic precursor glutathione support tool to help repair and prevent. And for this particular type, her blood sugar level from a 12 down to anywhere from a 5 to a 7, which is fantastic. We're doing other things, but one of the main treatments is to supporting this glutathione. So, I mean, across the board, as we age, there's more oxidation going on, there's more degeneration, and basically these factors set up a chronic inflammatory state, which is precursor for all illness that can present itself from cardiovascular disease to diabetes to cancer to autoimmune conditions to all sorts of different things that can show up over time. And glutathione is definitely one of those pieces that decreases in these types of conditions. So not only with age and the chronic oxidation process and also the chronic degenerative process of chronic illness, we will always see a depleted level of glutathione. So to have a tool such as GSH, it's easy to take. There's a specific program for it, and it helps to maintain healthy levels of glutathione. It's basically future-proofing your body so that you're able to not only treat a chronic illness, but actually also prevent it as well. So that's been a real value add for our clinic and for our patients, and I'm looking forward to learning more about some of the feedback from patients who are actively using it. Yeah, so that's what gets me excited about using a product such as this.
Okay. You said that you use IV GSH. Now, this is you haven't substituted GSH complex for the IV. You're actually using it together as a package. Am I right?
That's correct. Yeah. I mean, the reality is that IV or intravenous vitamin therapy or intravenous glutathione will get quite expensive if you're wanting to do it on a regular basis. And according to the research that I've actually looked at, you can use, or in order to match the appropriate level of precursors, you would have to take a significant more intravenous form of glutathione to actually hit what you can with precursor support. So precursor in the form of L-cysteine and selenium and some of the other cofactors that help to build and repair glutathione, you're doing possibly more for the individual by having just a regular daily dose of it as opposed to frequent or infrequent administration of IV therapy.
Earlier, when we discussed a little bit, we had discussed a little bit about the implication in the as a means to help with degenerative eye problems. I know that was an aspect that touched you a little bit more. Can you explain a little bit about that aspect?
Yeah, I mean, this is another common issue that shows up as we get older, degeneration, and I mean, in response to diabetic retinopathy or just general macular degeneration, cataracts, and different things that show up as we get older. And our little microvessels, such as in the eye, are really susceptible to problems in chronic oxidation inflammation. So found it quite unique to see that there's a product such as GSH that you can use in a topical form to help correct some of the damage that happens over time with low antioxidant levels and inflammation and everything else. So you
well, yes.
Yeah. Basically, I was just going to let you know that I'm using it on one patient right now as a topical eye treatment, and I'm looking forward to hearing back from them on how things are going. But from what I'm learning from your team, that you've had a lot of success with reversing cataracts and different eye pathologies. So it's exciting to hear that.
Yes, definitely, and I actually personally look forward to seeing the results of your patient that's actually using it for that exact same problematic. So how likely are you to actually refer this product to your patients for a regular basis?
Yeah, that's a good question. I mean, in my practice, we definitely see a good portion of people going through hormonal imbalance in life, people who are dealing with more chronic illness, and then we're seeing people who are just focusing on optimal health and wellness. So basically, glutathione is such a universally supportive product that it can be used across all these different paradigms of health and problems with health. So the viability of the product and the usability and the program or the system that's involved in using the product is very easy to implement, and like I said, it has a universality approach to not only prevention but also proactive treatment for chronic illness, but then also as a lifestyle product to help maintain and get people in. So the beautiful thing is that there's no one that I can think of that wouldn't benefit by raising and supporting glutathione levels. The world that we live in is definitely increasingly toxic, and we're constantly being bombarded by its toxicity in all of the various forms and exposures. And in my clinic specifically, I do work with a lot of, as I said, hormonal imbalanced patients, and we know that rising levels of toxicity are a direct correlative problem for people experiencing hormonal imbalance. So definitely that's a big part of the application that we see as an effective treatment tool in our clinic.
Well, that actually sounds great. I can see that I would love to be able to discuss with you a bit more in detail. We will look forward to all the results from your patients. Unfortunately, right now, I believe we are running out of time, so I'm going to say thank you very much for taking the time out of your busy schedule to be with us tonight.
Well, thank you so much, Jeremy. I mean, I love talking about health and all the different ways to prevent and be proactive. So, if this helps, one or two people to, making changes in their health, and